Folks, life, liberty, and the pursuit of happiness. It starts with life. Nothing else is possible without life. Hat tip to the Weekly Standard. First you're going to hear a representative. Then you're going to hear a lady by the name of Snow. Then another representative, then a lady by the name of Snow, and so forth. The lady by the name of Snow is the lobbyist for the Florida Alliance of Planned Parenthood Affiliates. I want you to listen to this. Cut one, go.
It's just really hard for me to even ask you this question because I'm almost in disbelief. If a baby is born on a table as a result of a botched abortion, what would Planned Parenthood want to have happen to that child that's struggling for life? You're recognized.
Thank you, Mr. Chairman. We believe that any decision that's made should be left up to the woman, her family, and the physician.
What happens in a situation where a baby is alive, breathing on a table, moving? What do your physicians do at that point?
You're recognized.
I do not have that information. I am not a physician. I'm not an abortion provider. So I do not have that information.
I understand that you're not a physician, but you do represent physicians who do perform this activity. And can you tell me what happens when a baby is alive on the table at that point? What do they do with the baby that is struggling to live?
You're recognized.
I don't know, and as it's been referenced earlier, we don't know even how prevalent this situation is.
I don't know how else I can get an answer, Mr. Chairman.
Can you believe this? We don't know how prevalent this situation is. What kind of a society have we become where we, the people, fund organizations like this, lobbyists like this? It should be that we do everything humanly possible to protect our babies. Our babies. I'm so sick and tired of the left in this country going on and on. Every time they want to rip us off and spend more money and expand the size of government and fund the National Education Association, every other damn left-wing group, they talk about the children. They talk about our babies. Meanwhile, they're breaking their backs, the next generation and the generation after that, with what they're doing on the debt. And here, the question is, if the baby is delivered and on the table and moving around, what is the position of Planned Parenthood in terms of that baby? What do you do with the baby? I don't know, she says. I'm not a physician. Are you a human being, lady? I don't know. I'm not an abortion provider, so I don't have that information. You don't have what information? You don't know what you do with a baby that's delivered, that's living and breathing? This is a hard question. Is this a hard question like drones flying around in the sky and people sitting in a cafe? Is it a hard question like that? And then when conservatives want answers and keep pressing and we finally get an answer, there's something wrong with us? Is that the kind of question this is? This requires a full-scale congressional investigation. I would like to know, I suspect many of you would like to know on this Easter weekend, on this Passover week, how many babies that are delivered are killed, if any. This lobbyist found this question perplexing, and she couldn't answer it. And she was asked. She couldn't answer it. But there's more, Mr. Producer. Cut 2. Go.
You stated that a baby born on a table as a result of a botched abortion, that decision should be left to the doctor and the family. Is that what you're saying?
It should. Thank you, Mr. Chairman. That decision should be between the patient and the healthcare provider.
Stop. No, it's not between the patient and the health care provider. It's murder. If that, in fact, is what happens, what do you mean it's left between the patient and the health care provider? Go ahead.
I think that at that point, the patient would be the child struggling on a table. Wouldn't you agree?
That's a very good question. I really don't know how to answer that. I think, I would be glad to have some more, conversations with you about this.
So we don't know. We don't know what the answer is. She wants to have more conversations, even though she's not a doctor or an abortion provider. So what good is having conversations with her? We're spending hundreds of millions of dollars, and over a course of several years, billions of dollars subsidizing this organization, and their chief lobbyist testifying for the Florida Alliance of Planned Parenthood affiliates can't state what happens to a baby after it's born, what they do or don't do for it. It's between a patient and the physician? No, it's not. No, it's not. There's a little bit more. Cut 3, go.
What objection could you possibly have to obligate a doctor to transport a child born alive to a hospital where it seems to me they would be most likely to be able to survive?
You're recognized.
Thank you, Mr. Chairman. What about this, and I'm just speaking out loud here, what about those situations where it's in a rural healthcare setting, the hospital is 45 minutes, an hour away, that's the closest trauma center, emergency room. There's just some logistical issues involved that we've got some concerns about.
Mr. Producer, is this woman of flesh and blood? You have some logistical problems? What kind of an answer is this? Ladies and gentlemen, just put this in your mind's eye. A beautiful little baby is delivered. It's alive. It's put on a table. It needs help. The abortion was botched. What do you do with the baby? The official answer of the lobbyists representing the Florida Alliance of Planned Parenthood affiliates is it's between the patient and the doctor. So if the patient and the doctor, or she calls it the patient and the provider, the abortionist, if they decide to take the baby and fling it out the window, is that okay? If they both made that decision? If they decided to take the baby and dunk it in a bathtub until it died, is that okay? Because they made the decision? If they decided not to call an ambulance because it might the emergency room might be 45 minutes away, so the baby is on the table just flopping around like a flounder, is that okay? Is this what we've become? Is this where we're going? But it's a choice, Mark. No, it's not a choice. It's not a choice. You liberals, you lecture us condescendingly, arrogantly, delusionally, quite frankly, that if our taxes don't go up, if we don't pay for this institution or this constituent group, if we don't redistribute wealth, if the federal government doesn't get bigger and bigger, that our children, our grandchildren are going to suffer. And here we have a baby, an example, a baby truly suffering, struggling for life, a baby that was delivered. And one of your favorite organizations, Planned Parenthood, acts like it's a goldfish. We don't treat animals this way, nor should we. No respect for human life, no regard for human life. All this talk about equality, all this talk about spending money, all this talk about redistributing wealth. And look at this. I don't care if you're religious or not. This is grotesque. This is inhumanity. This is what we pay for. We need some answers. Does this situation occur? And if it occurs, how often does it occur? Because frankly, it's flat out murder. I'll be right back.